Only on NBC5 tonight, hospital systems locally and nationally are tackling the coronavirus pandemic head on. It's a challenge medical professionals say they never thought they'd see in their lifetimes. NBC5's Amanda Rose spoke with both Asante and Providence leadership to learn more about what's happening in our community.
We have an ability to impact this. It's really focused on the behaviors we choose to engage in.
The coronavirus pandemic is a crisis that's tested the leadership of local hospital systems. Asante's Chief Medical and Quality Officer, Dr. Jamie Grabowski, says the biggest challenge the hospital has faced is their limited ability to provide continued care to the community.
From our expanding to open up video visits to having to delay urgent procedures.
With an increased demand for COVID-19 tests, Dr. Grabowski says testing supplies are running low. In April, the average test volume at Asante's Medford collection site was 56 tests per day. That number jumped to 225 per day in June.
Given the lack of supplies and reagent to run the tests, we have to triage those tests to the most critical ones.
CEO of Providence Medford Medical Center, Dr. Tom Lorish, says the hospital is also feeling the impacts of the supply shortage.
As a part of a large 7-state organization, we do have access to testing and can push the suppliers to provide it. That said, it's still very scarce.
When it comes to intensive care unit space and personal protective equipment, Dr. Lorish says the hospital is doing well. As of Friday morning, he says they had no COVID-19 patients.
But we do not have a lot of excess capacity, and I believe that's true for everyone. This will be an issue going forward.
Asante says it also has enough space, with 22 unused beds, 55 unused ventilators, and can surge almost an additional 100 ventilators in its ICU. But in the weeks to come, both hospitals say that could always change.
As I said, it's a marathon, so more to come, but let's be vigilant.
In Medford, Amanda Rose, NBC5 News.
Asante plans to meet with Governor Kate Brown next week to ask about more testing supplies. If the hospital does not get more supplies, we're told tests will have to be sent to the state lab, resulting in longer wait times for results.